Knock knock, I'm Sierra, I'll be your student nurse. Washing my hands. Pulling the curtain for privacy. Putting on gloves. Can you tell me your name and date of birth?
Joe Smith, 10/5/85.
Okay, are you allergic to anything?
Sulfur.
Okay, I'm just going to verify that with your wristband and the doctor's order. Okay. I have a doctor's order to hook up a medication IV. Is that okay?
Yes.
Oh, okay, great. So the first thing I'm going to do is make sure that your IV is running. And it is, so okay, good. So then the next thing I'm going to do is check for any signs of phlebitis, redness, tenderness. Does this hurt?
No.
Okay, so that's good. And then I'm checking for infiltration, and I don't see any pooling underneath or on top. So no signs of infiltration. Then I'm going to read you my just some information about your medication. So the normal dose, usual dose would be 250 milligrams to 1.5 grams every 6 to 8 hours. Up to 6 is usual, but 12 in 24 hours has been used depending on the severity of the infection that you have. The dilution would be each 1 gram is diluted in 50 to 100 milliliters. The rate of administration is 1 gram or fraction thereof over 3 to 5 minutes. Indications and uses are treatment of serious infections of the bone, skin, joint, soft tissue, respiratory tract, septicemia, stuff like that. Then precautions that we will watch is hypersensitivity to or hypersensitivity reactions. So like if you have a history of penicillin or sensitivity to multiple allergens, we're watching you for signs of allergies. Then your lab interactions would be risk of nephrotoxicity, which could be increased with other nephrotoxic agents like loop diuretics. Side effects would be anorexia, diarrhea, elevated BUN and creatinine levels. Severe side effects would be anaphylaxis and seizures. There is no antidote. We would just notify the physician of any side effects that you're having. So now I'm going to do my first check, and so just showing you, so I'm not cheating over here with these papers. So my first check, so 0.9, first check. Then I'm going to tell you my math would be 75 milliliters per hour, 12.5 drops per minute, which is 3 drops per 15 seconds. Then I'm going to do my second check, 0.9. Then I'm going to do my 5 rights, right patient, right med, right route, right dose, right time. I'm going to do my third check, 0.9. Okay, so that's my third check. Also checking the doctor's order with the MAR. So then after my third check, I'm going to open my package. It is intact. They're both intact, not expired, not compromised. So I'm going to open this, and I'm going to make sure that this is closed. Okay. And then after I close that, I'm going to pull this open and pull this out. And I'm going to go thumb to thumb and spike it. Okay. And then I'm just going to hang that right up here. Okay. So then after I hang that, I'm going to hang this one. The blue thing. All right. So then I'm going to, if I can find it. Okay, find the clamp closest to the bag. And I'm going to clean it vigorously for 30 seconds.
30 seconds.
Alright, so 30 seconds is up. Then I'm going to, there it went. Very carefully not to touch the ends. I'm going to take these two thumb to thumb and hook them up. Okay, so that is connected. Okay, then, okay, so now that they are hooked, now I'm going to pull this off. I'm going to open my clamps. And I would wait for this to fill and the bubbles. Okay, so then once I see bubbles, I'll close it back, or we'll leave it open and put that up there. So we'll leave that open. And then, so that's in there. Oops. Okay, and then, okay, so now that this is running, now I will do, make sure, I'm going to run it with this, but check the drip rate up there. And I'm going to make sure that it is running 3 drops per 15 seconds. Okay, so 3 drops per 15 seconds. Then I would label my tubing with my name, date, and time. And then to remove it, I would pull the tape towards the center. I would make sure that there was a clean pad underneath. Then I would take a 2x2 clean gauze. Oh, I would wash my hands. So we'll do that. Wash my hands and put on clean gloves. And then I would change the pad, make sure there's a pad underneath, pull the tape in towards the center, and take a 2x2 gauze and gently hold it over, pull out the IV, apply gentle pressure for 2 whole minutes. So 2 minutes.
2 minutes.
Okay, so after 2 minutes is up, then I would fold my 2x2, a new clean 2x2 gauze in 4s, apply pressure and tape. And is there anything else I can get for you? I have the time.
No,